Question about the presentation of the slides. And I'd just like to drop to the slide that's called Context Cabinet Proposals. And on the final paragraph of that, it talks about the would involve consulting with the residents and families and with a wider body of care providers about reassessing resident needs to provide suitable alternative accommodation. I'm just wondering if reassessing is some sort of a code for reclassifying needs in order to fit private sector criteria.
Thank you, Chair. So there isn't a difference in criteria between a private sector residential care home and the council-run dementia care services. There would be if someone required residential care versus nursing care. But we do need to go through a formal assessment process to make sure that we fully understand somebody's needs. We do that before someone moves into a care home. We do that as someone's moving between care homes. But there's not an attempt to reclassify somebody's needs. It's to make sure that we fully understand somebody's needs and that any service anyone moved to is fully able to meet those needs.
Yes, thank you for that clarity. It just occurred to me as we were going through the slides. I do have a more general question for Richard Parry. And this is a point that has been raised several times by concerned relatives, and one which we have Mr. Parry and I have previously discussed. Given that there's a body of evidence gathered from around the country and indeed internationally, which indicates that disrupting settled residents with dementia very often has serious adverse effects on the health and longevity, will consideration be given to seeking alternative service providers who can take over each or both of these homes as going concerns?
Thank you, Chair. I'll attempt to answer that. I think it's fair to say that in 2018 we did a similar exercise where we looked to sell the provision of both homes. That was unsuccessful at that time, but it is something that the families have asked us to explore. So I think in the spirit of, excuse me, pardon me, in the spirit of openness and transparency, it is something that we are willing to explore should a decision be made to close the care homes.
Thank you for that. Reassuring. Now we're moving to the panel. I know there are a number of members with questions. So could I ask Councillor Addy, any questions to her?
Thank you, Chair. Is there appropriate quality capacity locally in the private sector to accommodate all these residents, and what would that transition look like if closure became the option in terms of timescales, support for residents and their families, coordination of the offers of places on the basis of things such as location and care needs, but most of all, and Councillor Armour has alluded to this as well, how will you mitigate for what has been shown in some cases to be devastating effects of moving patients with dementia from their settled arrangements?
Thank you for that question. So yes, there is provision of residential care and indeed nursing care across Kirklees and meets the needs of people living with dementia. What we would need to do is go through, for each individual, a conversation with family, a proper social work, a multidisciplinary assessment to understand the specific needs of an individual, including whether at some point in the future nursing care might be more appropriate for that individual. And then for each individual come up with an individual plan, if they were to move, about how we would manage that transition, that movement to another care home well. Care homes do close, and there have been a number of care home closures in recent years across Kirklees, including care homes that provide services for people with very complex needs, including complex nursing care. And there's a body of good practice about how one manages a care home closure or the movement of an individual between a care home. And indeed, people do move, say, from having lived in a residential care home, their needs may change, they may need to move to another provider, move into a nursing home, for instance. So people do move between care settings. And you're absolutely right, it's important that we plan and manage that well. So that starts off with understanding what's important to the individual, following nationally established best practice about, for instance, if about staff from the home that someone's moving into, potentially moving to coming and visiting them in their current home. Likewise, staff, and particularly as sometimes when private sector homes are closed, that's been a fairly rapid process from the private sector provider first notifying us that they intend to close through to the home closing. We have the ability to manage that process over the timescale that works well for people, so we'd absolutely expect that there are visits from staff from the potential new home to someone's existing home, that there's the exchange of information, but likewise staff that already work with an individual going and working into the new home to prepare and make sure that home's familiar with what works well for an individual, moving with somebody and managing that transition afterwards. And clearly, as part of that, we want to make sure that there's a proper conversation with family members about what's important, that we're pulling together the right professionals to manage and coordinate all of that.
Thank you. Councillor Munro, would you like to ask a question?
Thank you, Chair. So my questions also relate to capacity, because capacity is an emerging high-level theme from stakeholders. So in the event that a decision is unfortunately made to close these care homes, I would like to know whether there will be an impact on hospitals in terms of their patients waiting to discharge or transition to a care home, as capacity is going to be reduced across Kirklees. So my question is, will there be sufficient capacity in private care homes to continue to accept those patients from hospital and avoid delays? Thank you.
Thank you. So clearly, if someone's currently already living in a residential care home and gets admitted to hospital, we'd expect that that individual went back home back to their own care home as quickly as possible, so there shouldn't be an impact on capacity in that sense. If someone's not currently living in a residential nursing home and is living at home, our philosophy is we'd want to get that person back to their own home, and the NHS has recently put additional investment into a number of areas. We run 2 effectively step-down care homes, which provides support to people who can't go straight back home but need bed-based care and perhaps input rehabilitation before they can go back home. We also have things like wraparound reablement services that work with people back in their own homes to get them back on their feet and living as independently as possible. So there should not be an impact in terms of care home capacity and discharges, because we've moved away from a model of which we had to during the pandemic, but it didn't work as well as it didn't work well for a number of reasons. We don't use, or we try and avoid using, short-term placements into long-term care homes, because that's very disruptive for a long-term care home, particularly if it's a hospital discharge. But secondly, there's the risk that actually, if someone stays in an acute hospital bed, they can decondition, become less independent, but the same is equally true if they're in a short-term placement in a long-term care home. So we really be focusing on getting people back into their own home rather than using care homes as a step down. Where people do need a step down, it's into those 2 dedicated facilities that we've got to make sure there's really that wraparound reablement, rehabilitation support that keeps people independent and gets them back home again.
Thank you. My second question again is around capacity. Where there may be a dementia patient in either of these homes that may unfortunately close, who may have more complex needs. So will there be capacity available for those patients with private providers? Will they be able to accommodate those people who unfortunately have highly complex needs? Thank you.
Just 3 dads, walking in memory of their daughter.
So we've got a range of providers across Kirklees who support people with complex needs. What we would clearly be doing is looking to have the conversation with individuals, with families about what the right solution is. And that will clearly be at a point in time, so we know that there are providers who currently may have capacity. That capacity at that point in time may not be available, but the converse equally is true. But at this point, we understand there's capacity out there. We've seen some homes reopen in recent months, or open again, wanting to provide residential care for people living with dementia run by a local operator. So we understand there to be capacity out there. Clearly, at a particular point in time, that will change, and we'll need to make sure we work with families to understand where's the right long-term solution, whether there's capacity there, whether we need to wait for a bed to become available, because as I said, we'll manage this over a time period that works well for people.
Thank you. Kim Taylor.
Thank you, Chair. So my question is around the plans for the Dementia Day service. What will the plan be for the Dementia Day service that's currently at Castle Grange? Should it close? I understand there's a new facility. Sorry. I understand that there's a new facility being built at Murfield, but can you give any assurance that there won't be any break in service provision between the potential closing of one and the opening of another?
Yeah, we can provide assurance that the service will continue until the new provision opens next summer.
Thank you.
Councillor Lawson.
Thank you, Chair. Is going back to one of the common themes that I've had with when I've been contacted by residents is regarding the Cabinet report. It says that there are 57 care home providers, but each of these emails that I've gotten, telephone calls, are saying that there is only 6 providers for dementia care. Can we have some reassurance that that number is far greater?
So we pay a premium to providers who specialise in supporting people living with dementia. There are 23 care homes across Kirklees for whom we pay that premium because they are specialist dementia providers.
Thank you.
Come back here. Councillor Alley, do you have the questions?
Thank you, Chair. I just had a question more from the perspective of the residents' carers. So in the worst case scenario, if these care homes were to close, I appreciate the concerns of carers and relatives around that transition. And what assurances can you provide, or what provisions will be provided that we can assure, those carers that there'll be a proper transition and sort of facilities to enable that to be seamless and as comfortable as possible for residents?
Okay, I think Richard's already touched on this point, but I think what we've said is because they are council-run homes, we do have the flexibility to work with families for as long as possible to make sure that we're doing individual care planning, that the staff who are supporting and know their loved ones as well as possible will work with those individual families, work with their advocates to make sure that there is wraparound support. And I think, did you mention about the carers themselves, the provision for the carers? Do you mean staff?
So staff and relatives as well?
Yeah, okay. I think in terms of carers, we will support them to the best of our ability. We do appreciate how difficult this is for families, and that's why we're wanting to work and talk to families as much as they possibly want to talk to us. I think in terms of our staff, we do carry, unfortunately, a number of vacancies within the council, so we would look to deploy our staff anyway into different alternatives, and we'd work with them and their union colleagues and do similar like we do with residents who work on an individual basis for those staff to see what alternatives were available for them. Thank you.
Thank you. That's really
So
reassuring.
part of the design of the consultation process has been the offer of individual conversations with family carers, so we can make sure we can understand the specific needs of each resident and of each family and build that into the considerations for Cabinet.
Yes, thank you. Councillor Lawson, one very quick last question, because then we're moving on to a different item, short of time. So you had a question.
Thank you. There are a number of respite beds at both Castle Grange and Claremont. What facilities would there actually be moving forward to support carers that actually probably maybe just need a break from 24/7 care of their loved ones moving forward?
As I said in the presentation, the respite provision at Castle Grange is no longer available for families. It's available at Claremont. We have the ability to purchase respite provision in the independent sector, and like any person, we would work with that individual family to see what best meets their needs. And like we said earlier, we are looking to extend opening hours at the new provision that will provide 7-day-a-week support for families, recognising that getting respite and getting that break during that week, for a lot of families that happens to be on a weekend, so we'll be looking to extend our opening hours, and that would go into evenings and weekends.
And thank you for that. Now, we need to move on, panel. I think at this moment, because there's still an ongoing consultation anyway, I think we need to note the information we've received. It's something that we will be keeping an eye on, and it's something that we may return to in the future. Once the outcome of the consultation is clear, we may come back to it, I don't know. Councillor Smage.
Yeah, can we just very quickly, I'm sorry to interrupt Chair on this. There was a matter that was brought up on financial information that was not accurate. So can the scrutiny panel just have clarity on that, so that we've got that information for the future, please? Yeah, please.
Sorry, yes, we will provide that. Thank you. And we'll clarify what the family members have risen.
Yes, thank you for that, and thank you, Councillor Smage. We're going to take a short break now.